Welcome. My name is Professor Nora Colton, and I'm the Director of the Global Business School for Health. I'm going to be talking to you today about our MSc in Global Healthcare Management, our analytic route. It's a particularly interesting route, and we did a lot of research to establish this, and it was something that performed very well with employers. Now, before I get going, I'd just like to tell you a little more about the Global Business School for Health. We're the first business school in the world totally dedicated to educating the next generation of health and healthcare management leaders. We recognize that there's a real gap in the market, that health and healthcare consume more and more of GDP. In some countries, it's between 10 and 20%. And we also see a lot of low and middle income countries doing what we call catch up. They're accelerating their investment in their healthcare systems as they notice that health is more and more important in the societies that we live in today. And there are a number of reasons why. One is because demographic change. We see that societies are getting older, more people are needing to access the healthcare system. We also recognize that there are many more people with non-communicable diseases such as cancer and strokes and diabetes. And then last but not least is climate change, which is having an impact on our health. And you know, our lifestyles are also having an impact on our health. So there are many reasons why healthcare and the healthcare sector needs to evolve and change and be reimagined. And much of that has to do with ways in which we think about the sector. So that's really where the Global Business School for Health comes into play. It looks at that intersection between business and health and offers an opportunity for you to really be at the cutting edge, those leaders, those thought leaders and thinkers in this important sector. So this particular program, the Global Healthcare Management with the Analytic Route, is a program that was designed really with lots of feedback from employers about what they wanted in a master's program, kinds of students that they would be looking to have as prospective employees. And there were three areas that really emerged. One, of course, was finance and better understanding and knowledge of finance. The second one, of course, is leadership. And the third one is analytics. More and more analytics and numbers and data have become so important for driving our decision making, our thinking. Historically, we have thought that you go and you sit in front of a doctor and you tell them about what's wrong with you and they make a decision. Now more and more can be done with AI, with data. So having that ability to process that data, to understand coding, to understand, what constitutes appropriate data and information for making decisions in healthcare has never been more important. And those kind of decision-making skills, that ability to use and understand analytics and the important role, both in terms of visualizing it to make an argument, as well as crafting, the sector using data. So that's what this program is really about, is about helping you not only get your skills honed in terms of healthcare management and understanding the healthcare management sector, but also getting that added component, that specialization in analytics. So before I get into talking more about the program, I just want to take a moment to talk about the admissions and the entry requirement. This program is really open to a variety of people and backgrounds. And of course, having quantitative skills is really important because much of what you'll do and learn is in that quantitative space. So we're looking for people with a bachelor's degree in either health or science, social sciences or business or a related topic. So a related topic might be mathematics or it might be business analytics. Those are also very good backgrounds for this program. And of course, if you've got extensive work experience, that can also play an important role in this program. You do have to have a 6.5 or above on your IELTS. You need a personal statement and you need one reference to come onto this program. Now, who is this program for? Like I said, it's ideally for individuals who want to be healthcare management leaders, who want to be really the change makers, the thought leaders. So you can be a recent graduate, or you can be somebody who's out and been working for a number of years with some relevant work experience. But what we're really looking for is people who want to get some specific subject knowledge in say analytics and in the healthcare space, and really couple it with that broader kind of management and leadership skills as well. So how does this program work? So you're part of this larger program, the Global Healthcare Management Program. You'll have a 1-week induction. Prior to coming to induction, we'll provide you with a course on global health. It'll focus on global health from a system standpoint, because that's really integral to the Global Business School for Health. So that course will expose you to lots of different health systems, and think about health systems and global health in a macro sense. It's an opportunity for you to understand some other health systems other than your own health system, and learn, about this important space. So you'll take that. It's an online course. You will work at your own pace, and that you'll do just to kind of get that knowledge. And we are designing that with a person named Mark Brunel. He leads KPMG's global healthcare, and he is also written a great book on In Search of the Perfect Health System. So it'll be a fantastic opportunity to hear him lecture on a number of topics within that online course. Then during your induction week, you'll also have the opportunity to network, to get to build knowledge and experiences with your cohort. And it's not just people on the analytic route. You'll be mixing with the people on the finance route, as well as also the people on the leadership route, so that you can form 2 kind of groups: your smaller group, which is those on your specific specialism, and then the wider group that you'll work with who share that passion and drive to make a difference in healthcare management. Then in term 1, you'll take the way we've designed this program is that those 2 groups that I just mentioned to you, that you'll get to know during your induction, you'll have 2 modules from what I call the core. Those are the core modules that all students, regardless what route they are, take. So there's one that's really designed to build your leadership and management skills, one your human resource skills, and the third one is really around finance, and the last but not least is on health systems. So those 4 modules are broke up, 2 in term 1 and 2 in term 2. So you'll take that along with your colleagues, and then you'll begin to take 2 courses in your specialism in the analytics route. And then that will be married again in term 2. So the idea is really to give you an opportunity to work as a group and get on your specialism, but also to have the opportunity to be part of the larger program. And that's also really important because you're going to work across the year on a business project. It's about developing an idea for a healthcare improvement from concept to business case. So in term 3, you'll have 2 capstone assessments to kind of wrap up your program. And one of them will be your group project, which is going to be the business project that I just described. And the other one will be your research topic and project. And that's an opportunity for you to do a piece of research on any topic you want to do. It's an individual project. And in term 2, we'll be giving you a number of workshops on methodology and how to do a critical research appraisal and other aspects of the research process. So you'll be ready for that. So it's a fantastic program. And when you do, by the way, your business project, you won't just do it with people who are on the analytic route. You'll do it across the 3 areas with other people as well. So just really also want to mention, we have an MBA in health that's also very interesting, and also gives a set of skills that you would expect in an MBA. So again, if you're thinking about you're not sure if you want to do an MSc or an MBA, the MBA is much more case-driven. It is for people who have some work experience. So if you'd like to learn more about that, please email us and we can tell you more about that. It's runs over, again, a similar, but what's the real difference between the MBA and the MSc is the MBA has a much more in-depth focus on careers and career progression and development. It has a 3-day residential. It also has, it's delivered in blocks, 4-week blocks. It covers everything that would be in an accredited MBA, but with a focus on health and health business cases. And then the students do 2 projects. One is a global health challenge project where they have the opportunity to spend 2 weeks in a lower middle income country working on a healthcare research project. And then they also do a health consultancy. So it is, often people wonder what's the difference? Well, the difference is the MBA is really about decision-making, about making you much more confident in terms of accelerating your career, thinking more holistic about business and management. The MSc is about really helping you hone in and gain a specialism. So just wanted to really mention that because often students ask us about what the difference is. So I just now want to talk quickly. There is, as I mentioned, for the MBA also, there's a different entry criteria. You need to have at least 2 to 3 years of work experience. You'd also need to take a GMAT, and there's an interview involved. So it's a much more involved entry requirement as well. There are scholarships that are available, both for the MBA. We've also got a scholarship for women in healthcare. It's up to £5,000 that can be put towards your tuition. The other thing about that scholarship is you'll get some great preparation. There's coaching, there's development for all the participants who receive that scholarship. And then last but not least, we have a scholarship for East London. There are also other scholarships that you can apply to. There's opportunities. If you're a US citizen, you can get a US federal loan. If you're a UK citizen, you can get also a graduate loan. International students, I always tell you to visit your British Council website, see what scholarships are available from your country. You might also find your government offers some, but there's some scholarships like the Chevening, the Commonwealth, the Fulbright, Brave, and there are other bursaries at UCL. So UCL has what they call a scholarship finder. You can just go to that, put your information in, and it will help guide you to other sources of funding. So it's really about thinking about what program you do and then thinking about how you're going to fund your time. I also want to mention that in addition to your 1-week induction, there's a real focus in this school on careers. You'll get a lot of professional advice, opportunities for professional development. Throughout the year, there'll be events, job boards. We've had a number of companies come forward wanting to have our students as interns, so there will be intern opportunities. Your project will have an industry mentor who will work with you. We have great career services at UCL, and they don't wait until midway through the year. They will contact you, start working with you right at the beginning of your journey on our program. And then we also have innovation and enterprise services. So if you're thinking about a startup or want to go into business for yourself, that's an opportunity as well. And then of course, UCL is an incredible institution with a wide range of alumni networks that you can tap into to help get advice and focus your career. So where do we see students going after this program? Well, there's lots of opportunities. You could go into health consultancy. Many students aspire to that. You can go into a management role. It doesn't have to be necessarily in a hospital or a clinical setting. It could be in a biotech or pharmaceutical firm. It could be in the World Health Organization. It could be in another global entity. And of course, you could get into a startup, a health tech, a med tech. The opportunities are immense. There's such a shortage of labor and people who are skilled and understand this space. And analytics is the future. So just lastly, I want to just mention a little bit more about UCL. We are a fantastic university. We are in the center of London, and there's clubs, sporting events, other societies. There's opportunities to volunteer. We've got amazing student service and well-being. So whether it's your mental health that you need help with, getting settled, we've got, for our international students, we have all sorts of career advice. You can work, by the way, as you're doing your degree, up to 20 hours a week. So really, UCL is such an incredible place to be a student. This program, by the way, will be taught at UCL East, which is part of UCL. It's in East London near the Stratford station, and it's a fantastic facility. If you look at this picture and you see the large kind of building there with some red, that's where we'll be teaching. The one largest tower actually is student accommodation, so fantastic for students who can get into those accommodations. They can just literally come down to the first floor of their building and be in the classroom. The park itself is the former Olympic Park. It's now called the Queen Elizabeth Olympic Park. It is wonderful. It's got waterways, water sports, there's an aquatic center, and it sits all next to one of the largest, or the largest, shopping center in all of Europe, the Westfield Shopping Center. Our Bloomsbury campus is 8 minutes away by train. You can take a train from Stratford to St. Pancras. And also, as a student at UCL, you can take advantage of both facilities and both campuses. You are a part of this kind of larger UCL family. And so it's just a great opportunity. The east of London is really where the growth is. It's where lots of young people are moving. Housing is very affordable, and the restaurants and life there are incredible as well. But life, moreover, in London, if you're an international student and you're not familiar with London, it's an incredible city. It's massive. It's full of tourist attractions, sports events and facilities. It has lovely parks. Most of the museums and galleries and institutes are free. It's not surprising that in 2021, it was ranked the top city for students in all of the UK. So really, it is an exciting place to study, to learn, and healthcare and health are so important. UCL has 5 NHS hospitals associated with it. There are so many institutes at UCL involved in health. And we're very excited, particularly on this program, to be partnering with the Institute of Health Informatics for many of the modules you'll take. So that's really all I have to say. We've got some time still, so I'd be happy if you've got any questions. We've got an event on the 15th of March where we'll talk some more about scholarships. We also, the MBA Health, if you want to learn more about that, we've got an open day at the end of the month and one next month. And we've also got an exciting webinar about workforce challenges in healthcare coming up in November. So keep an eye out for our events. Join us on Twitter, LinkedIn, Facebook. We're always looking to expand our networks and get to know you better. So I'm going to stop there, stop sharing my slides. If you've got any questions, this is your opportunity. I'll wait a few minutes to see if we have any questions, and then if not, I'll draw things to a close. So again, really nice to meet you. I hope you enjoyed the presentation, and I'll just pause now. So I see there's a hand raised, but if you could put your question in the, there's a Q&A button down at the bottom of your screen. If you could use that button to put your question, I can answer it from there. We've disabled the hand in the chat. So again, if you want to type your question into the Q&A, I can answer those. It's right down on your screen. So I've got a question. I work as a full-time doctor, so would be interested in doing this flexibly. Can you speak to how that might work? Okay, that's a great question. This is really, the way we'll teach this is what we call a flipped classroom. So you'll do quite a bit of the work, and there'll be materials and lectures that are done online. And then you will have the opportunity to also, have face-to-face. So if you're taking flexible means you're going to take the program over 3 to 5 years. If you take it part-time, you take it over 2 years. So if you take one of those options, you would have each year, you would need to have at least, I'm trying to think at how that works. So you'd have at least once a year where you'd need to, for 10 weeks, be able to come in for a couple hours to do your module. And the timetable is produced in advance, so you could possibly work that around your work schedule. If you're taking it part-time, you need probably about half a day, again, once a week to take it. So you can either do it over 2 years or 3 years. So essentially you would work with us. We would make a plan for you if you were going to do it over 3 to 5 years about how and when you would take the various modules to complete it. So you complete the same modules, but there will be some times where you will have to look at your schedule and come in. So if you're doing it flexible, you'd have to keep progressing over that period. You'd have to take some of the modules. The two kind of core capstone modules, the business project and the research project, they don't require you necessarily to have class time, but there will be workshops where you'll have to prepare. Some of that can be done online, but again, we would have to work individually with you on that. So if you're going to take it part-time, you could anticipate that you probably need half a day once a week during term time, in term 1 and term 2. If you are going to do it flexible over a longer period of time, you'd need probably at least 10 weeks. So part-time, you'll need 20 weeks out of the year where you would need kind of half a day. And if you're doing it flexible, you'll probably need 10 weeks out of the year where you'd need kind of a time off, to half a day. So I hope that makes sense. Again, we'd be really happy to sit with you and put you in contact with our education manager who could help you kind of lay it out so that you could see it and understand how it would work exactly. Okay, any other questions? All right, well, I don't see any other questions coming in. Again, thank you so much for your time. We will upload this presentation on our website. So if you've joined late and you'd like to see more, please do that. Have a great afternoon. Thank you so much. Bye.